can happen at any time. A heart attack is the leading cause of death for both men and women, claiming the lives of more than 500,000 people a year in the U.S.
Looks like you might be having a heart attack, Mr. Jones.
During a heart attack, every minute counts. The shorter the time to open that blockage, the better the outcome for the patient.
This short window for treatment, what is known as the golden hour for receiving crucial heart care, can truly mean the difference between life and death. This is why it is so important for anyone to recognize the early symptoms of cardiac distress, including chest pain, shortness of breath, and pain in the upper body.
To make sure he's on the monitor, we need another large bore IV. You don't have any cardiac history or medical history? You don't take medications for anything?
You've heard the expression, time is muscle. So from the time that you have an occlusion of a coronary artery, heart muscle starts to die. It typically does not come back. So time is a key element in treating a heart attack.
The life-saving importance of getting to an emergency department as quickly as possible after the onset of chest pain is most critical. It's also important to know where specialized cardiac care is available in your community. At the top of the list is a health system with state-of-the-art medical care to treat an ST elevation myocardial infarction, or STEMI, the deadliest type of heart attack.
This is the king of heart attacks because it's the one that carries the highest mortality as well as the disability for the patient. Time is of essence. During a heart attack, STEMI type, the coronary is completely occluded. You can call it a blockage with plaque buildup and also a thrombus and clot. The first hour is essential because most of the damage occurs there and it will be complete after 6 hours.
Dr. Cesar Hara is one of a team of interventional cardiologists for the Heart Center at the Holmes Regional Medical Center in Melbourne, Florida, performing thousands of these STEMI procedures each year to save the lives of heart attack victims. These cardiologists rely on a tremendous team effort of medical professionals and the most modern technology available within a STEMI health system.
The team is absolutely well oiled. By the time they hit the emergency room, they get EKGs, they have an assessment by a physician. The nurse team starts addressing the introduction of intravenous therapy into the patient. It is a rapid track from the emergency room into the cath lab at that point. They get into the cath lab, the second part of the team takes place. That's the cath lab team. They are the professionals that will assist the doctor in the rescue operation and opening that artery.
For an interventional cardiologist, it means medical knowledge must constantly be updated for the technical application of each piece of modern equipment. It also requires the ability to work seamlessly with a heart center team that is highly trained for split-second decisions.
The most important treatment is aimed to open the blockage. And the best way to do it is with primary percutaneous coronary intervention, which is also so-called angioplasty and stent.
The STEMI system is now the worldwide standard of care for patients with heart attacks, a benchmark for quality care and successful outcomes, which translates into prolonged life and avoiding permanent disability.
That is the key, to provide to our community, region, across counties and across different hospitals and networks the best care. And this particular hospital, Holmes Regional Medical Center, has aimed to that. And I think that we are succeeding because we are treating patients from outside this center, which are transferred to our center in a timely manner.
Today, more diagnostic and treatment options for cardiac arrest are available than ever before, resulting in more lives being saved. The key is knowing the warning signs of a heart attack and acting quickly to get the necessary care. A heart attack can happen at any time, and when it does, time is of the essence. As the only STEMI system in Brevard County, Florida that has interventional cardiologists on call around the clock to treat heart attacks, the Holmes Regional Medical Center sets the standard for the latest treatment options and advanced cardiac services.
It's extremely important to provide to every patient in the region the best care possible.
Well, the mission of Health First and Holmes Regional with our Heart Center is to provide extremely good technology with a superior trained staff and world-class physicians. You combine those three together and it provides an excellent recipe for surviving a heart attack.
Now, as the largest hospital in the county, treating more cardiac patients than any other hospital in the area, the Holmes Regional Medical Center and Health First overall continues to be at the forefront of providing education, diagnosis, and treatment for heart-related care. For more information, visit health-first.org.